Hi, my name is Abigail Gleason and I'm here at the medication administration video, and I'm here with Mariah Jung as my evaluator and Sean Patrick Navarro as my videographer. So I am at the MAR and I'm checking providers' orders and reading through information about my patient. So I have Jamie Wheeler. His date of birth is 10/31/1947. He has an allergy to codeine, so I'll need to keep that in mind as I'm reading through this. We have a provider order for digoxin 250 micrograms by mouth once daily. Hold for heart rate of less than 60. So I can see his heart rate here is 79 from this morning. So we are good to administer that for 0800. Vitamin B12, 1,000 micrograms intramuscularly just once right now. So that'll be at the 0800 again. And then Levemir, 10 units subcutaneously once daily. Again at the 0800, and that is an insulin detamir, so I know that I will need to have another RN come and check me before I administer that. And this is all signed by Dr. James Folk, so we are good to go there. There was no codeine ordered, so nothing to worry about with its allergies, and I'm not seeing anything that he is on an MPO or any contradiction that he is unable to swallow that was noted in any of this information. So we're good to go on his oral medication. So now that I've checked this, I'm just going to go ahead and gather all of my supplies that I'm going to need to administer this. So I'm going to open this up. First I'm going to get the digoxin, and I see here that this is 0.25 milligrams and 250 micrograms is ordered. This is the same thing, so we are good to go on that. Let me just go ahead and get out my cups here. So we have his water cup and his medication cup, and I'm checking the expiration on that, and it is 10/22, so we are good to go there. So I have the right medication, the right dose, the right patient for Jamie Wheeler, right route is oral, and the right time for 0800. So that was my first check at the MAR for the oral medication. And now I'm going to be doing vitamin B12, and I'm seeing that it is 1,000 micrograms per milliliter. This says vitamin B12, 1,000 micrograms IM one time right now, but since it's 1,000 micrograms per milliliter, I will be doing 1 milliliter of that. So let me go ahead and get out my 1 milliliter syringe. Right here. I will draw that up with an 18 gauge needle, and I will administer it with a 23 gauge needle because it's to be given intramuscularly. So going to confirm this at the MAR, and its expiration date is December 2030, so that's good to go. Confirming my patient's name, Jamie Wheeler, the right medication, vitamin B12, the right dose, 1,000 micrograms, right time, 0800, and right route intramuscularly. Okay, now I'm going to move on to Levemir. And that is 100 units per milliliter, and 10 units is ordered, so I'm going to be giving 1/10 of a milliliter. So I'm going to be also using the 1 milliliter syringe on that one. Let's see. Okay, here we go. I'm going to draw that up with an 18 gauge needle, and I'll administer it with a 25 gauge needle because it's to be delivered subcutaneously. So I'm going to complete my check here. Also, with its expiration is December 2030, we're good to go. Right medication, Levemir. For Jamie Wheeler, 10/31/1947. So right patient, right medication, right dose, 10 units. I'll be giving 1/10 of a milliliter to get 10 units. Right route, subcutaneous. I have my supplies, and the right time, 0800. So I've completed my first check for all the medications at the MAR. I'm going to go outside the patient's room now. And I am going to go ahead and do my second check outside the patient's room. So we have digoxin, 0.25 milligrams, digoxin 250 micrograms, same thing, orally by mouth. For my patient Jamie Wheeler, 10/31/1947. I have all my supplies for that. All right, we have vitamin B12, 1,000 micrograms intramuscularly, just once right now. Also, the digoxin was at 0800, so that's when we're administering it. Same for the vitamin B12. 1,000 micrograms per milliliter, 1,000 micrograms. I will administer 1 milliliter. I have my supplies for that. Same patient, Jamie Wheeler, 10/31/1947. And then I have my Levemir which is an insulin detamir. This is 100 units per milliliter, so I will administer 1/10 of a milliliter to get the 10 units. It is to be delivered subcutaneously. So I have my right patient, my right dose, right medication, right time, 0800, and the right route subcutaneously. All right, I have everything, so I will now enter my patient's room. Hi, Mr. Wheeler. How are you today? right, good. Can you please state your name and date of birth for me? Awesome, thank you, Jamie Wheeler. 10/31/1947 is your date of birth, and I see you have your allergy band on because you are allergic to codeine. Today I'm just here to administer your morning meds. You're going to be getting digoxin, vitamin B12, and Levemir. And give some privacy here. Close our curtain up. So, before I administer anything, I'm just going to do my third check at the bedside to make sure I have all of the right medications. So I have my digoxin, 0.25 milligrams, which is the same as the 250 micrograms of digoxin ordered, to be given by mouth once daily. Hold for heart rate less than 60. Your heart rate was 79 this morning, so we're good to go on that. To be administered at 0800 for Jamie Wheeler, 10/31/1947. Vitamin B12, 1,000 micrograms intramuscularly once daily, 0800. I have 1,000 micrograms per milliliter of vitamin B12 here. All my supplies to give that intramuscularly for the same patient, Jamie Wheeler, date of birth 10/31/1947. And then I have my Levemir, 10 units subcutaneously was ordered for once daily, 0800. This is 100 units per milliliter, so I will give you 1/10 of a milliliter. And this is a higher risk medication, so I will have another nurse come behind me and check the medication before I administer it to make sure I have everything correct. Okay, so first I'm going to give you your oral medication, and I have assessed your ability to swallow, and you are able to swallow. You're not on any MPO orders, so you should be good to go on this medication. So it is the digoxin, and I'm just going to tell you a little bit about that medication before I administer that to you. Okay, so digoxin is an antiarrhythmic medication. It's used for heart failure or atrial fibrillation or atrial flutter or paroxysmal atrial tachycardia. Common side effects might be anorexia, nausea, vomiting, fatigue, or bradycardia. If you have any questions about this medication, just let me know. But since I went ahead and did my third check at the bedside, I'm going to put this into the medication cup. This is your water cup. Let me just help you to sit up a little bit. All right, and there is your medication. And here is your water cup. Do you mind just opening your mouth and letting me make sure that you got it? Awesome. And I will be coming back to evaluate that this medication has worked. The evaluation would be that there is a decrease in severity of HF and an increase in cardiac output. So now that we have done that, I'm just going to discard of my supplies, and we will move on to your IM injection, your intramuscular one, which is your vitamin B12. So I'm just going to tell you about that one before I begin preparing it. Vitamin B12 is a vitamin. It's used for vitamin B12 deficiency, and common side effects are pain at your injection site. And we're just going to be giving that to you in your right deltoid muscle up in your upper arm. So I need to go ahead and get out my alcohol wipes and my gauze before I administer this one. All right, so I have everything I need for that. Just move it on up. So again, I have my vitamin B12. And I'm just going to clean the top of this. So that'll be clean when I get everything ready. I actually grabbed the wrong syringe. I need a 1 milliliter syringe, and this is a 3 milliliter syringe. So I'm just gonna put that back and get a 1 ml syringe. Let me see here. I will have someone in my group run and get me another 1 ml for your next injection, but I luckily already have one here, so I will use that one. Again, that is a 1 ml syringe. And I'm going to be putting an 18 gauge needle on that to draw up the medication. Okay, let's refer back to this real fast. So you need 1,000 micrograms of this, and it is 1,000 micrograms per milliliter. So I'm going to go ahead and pull out the air for 1 milliliter. And I'm going to uncap this needle. And I'm going to inject the air into here, making sure not to get it into the liquid. I'm going to invert it, and then I'll pull out 1 milliliter of this. Let's see. Of course, trying to not get any air bubbles in that. Again, giving this at 8 a.m. to Jamie Wheeler, 10/31/1947. His vitamin B12, 1 milliliter for 1,000 micrograms. Let's see. It's gonna get this back on. Confirm that that is on. And discard this into the sharps container. I'm gonna get a 23 gauge needle on that because we are administering this intramuscularly. All right. I'm gonna get you cleaned up on this arm where I'll be administering this. Doing this in a circular motion. All right, and I'm gonna note the landmarks as I do this, of course. Disengage that, uncap. So I'm gonna look at your chromium process, go a little bit down and use the Z-track method. Administer this at a 90-degree angle. And then administer the medication. And count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, I can let go now. Pull that back. Cover that. And put it in here. In the sharps container. And I will come back and evaluate you to, let's see, that was your B12. So the evaluation for that is resolution of the symptoms of a vitamin B12 deficiency. So that would be the proper evaluation for that medication. Go and discard of these supplies. Mariah, were you able to find a 1 milliliter syringe? Oh, amazing, thank you. So your next medication that will be administered is your Levemir, which is an insulin detamir. We're going to administer 10 units subcutaneously. So I'm going to get all of my supplies together. Levemir is an anti-diabetic hormone. It's used for control of hyperglycemia in patients with type 1 and type 2 diabetes mellitus. A common side effect is hypoglycemia. And again, this is the medication that I will need to double check with another RN. So just to get started, I'm going to clean the top of my vial. Okay. I am going to be using a 1 milliliter syringe of this because the MAR has an order for 10 units, and this is a 100 units per ml vial. So I'm going to be using 1/10 of a milliliter for that. And I'm going to draw it up with an 18 gauge needle. My gloves will allow me to open it. Okay. All right, and I'm going to pull the air out for 1/10 of a milliliter. Okay, I'm going to uncap the needle. I'm going to inject the air into the vial, being sure not to inject it into the liquid to make it easier, not get air bubbles later. Invert it, and I'm going to pull out 1/10 of a milliliter. Let me turn this so I can see it. All right. I'm going to recap this. It's in my hand. Okay, I'm going to discard that into the sharps container. I'm going to be using a 25 gauge needle for this because it is subcutaneous. Hey Mariah, do you mind coming to check this against the provider's orders? This is the Levemir. 10 units subcutaneously was ordered for Jamie Wheeler, 10/31/1947. So I'd use 1/10 of a milliliter because it's 100 units per milliliter. Is that correct? Mm-hmm. Okay, 0800.
Wonderful.
All right, I'm going to be administering this subcutaneously in your abdomen. Let me back up from that previous injection. We're going to be administering this into the upper right quadrant of your abdomen. And get that cleaned up. Okay. This is again subcutaneous injection of Levemir for Mr. Jamie Wheeler, date of birth 10/31/1947. 10 units subcutaneously once daily at 0800. I'm gonna pinch up a piece of skin and administer this at a 45-degree angle. And then I'm gonna inject it and count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let go and release. All right. Just carted this into the sharps container. Okay, and I would come back to evaluate for that. The expected outcome of that would be control of blood glucose in diabetic patients with the appearance of hypoglycemic or hyperglycemic episodes. So Mr. Wheeler, you just let me know if you're feeling any of these side effects that I talked to you about or any adverse effects, and I will be back shortly to come and check on you to make sure you're not experiencing any of those. And now I'm just going to step outside of the room and do my documentation. So I'm going to document on his MAR that I administered digoxin 250 micrograms by mouth once daily. It says hold for heart rate less than 60. His heart rate was 79, so I administered that at 0800. And right there, that his heart rate was 79, so I administered that there. His vitamin B12, 1,000 micrograms intramuscularly once daily. We did that at 0800 as well, and we did that in his right upper arm, which is zone 3. So I would just write maybe zone 3 on there. And then I also administered his Levemir 10 units subcutaneously once daily, second checked by my other RN, Mariah. Administered at 0800 in his right abdomen, which is zone 1. So I did initial there, zone 1. And I will just be making sure to assess him for any potential side effects or adverse effects from the medications that I administered. For Jamie Wheeler, date of birth 10/31/1947. That's the end of my video.